Okay, once again, thanks for you for attendance to our conference, and now we'll speak a little bit more about core dysfunction and core dysfunction associated injuries in professional sports, in civilian sports also. And before I start, I want to remember you once again our rock tape movability concept idea, that we are not responsible for the monotherapy. Kinesiotaping is not monotherapy. Functional tests are not responsible for monotherapy. Blading, mohawk, flossing, they are not about monotherapy. So we are responsible for multi-central approach in modern rehab technique. So we consider it modern and we consider it useful. For example, I am a director of my private clinic for ballet and sports trauma in St. Petersburg. So my idea and my task is to detect disorders, and if I need, I'm ask my colleagues to help me. I have osteopaths, manual therapists, kinesiologists, physiotherapists, and we together create rehab technique, multifunctional, multicentral, in order to create individual way of rehab. So that's the goal. We are not standing for monotherapy. We are for multi-central approach in rehab. Well, so we'll once again speaking about movement and all about professional movement. There are a lot of modern data tell us that our movement is responsible for longevity, and also we have a modern one investigations with that tell us that if we sit more than 6 hours a day, we add more than 20–30% to short our longevity in future. Here is a very sad video. In this video, they were interviewed, a number of children, and they were asked what will they do if they had 5 more years add to their life.
I could have an extra 5 years to live. You said 5, right? 5 years. It's a long time.
I would try to fix everything I did bad.
I would bring my uncle back because I miss him very much.
I would get more hamsters.
I would probably want to go looking for dark matter. I think I'd go looking for aliens. If I could live an extra 5 years...
I was thinking about making like a helicopter, like a wooden helicopter, but I don't have any wood.
I want to go check out the moon sometime.
I'd probably teach my sister not to hate tuna.
I would try and invent a machine that lets you run at light speed.
If I had 5 more extra years to live,
I would be the boss of all the chipmunks.
eu cantaria na frente de 1 milhão de pessoas. I don't really know. I think I'd do anything.
Why are you asking me that?
So it really happens. It happens now, and we are all responsible for our own longevity, and it is strictly related with our ability to move. Here is the modern data. So we'll see how to improve one's ability for proper movement, and thus to create our longevity up to 100 years. You know that picture. and we know that something now goes wrong. Thomas Meyer considered that movement creates habit, and habit becomes posture that creates structure. So we can't build a proper structure if we have a bad posture and if we haven't habit for proper movement. Pain. Pain is a main idea that do not allow us to keep the proper posture. We have different kinds of pain, we have different levels of pain. All of us had pain for some reason, maybe. But still, we don't know what is the pain exactly. We have a lot of investigation related to the pain, but no one investigator will tell you exactly what is pain, what is origin of pain. They consider it complicated. It depends, and it is. Well, you are familiar with pain gate theory. You know that we can get pain mitigation while affecting our mechanoceptors. So when we feel pain somewhere, we place our hand here, try to do something, and the pain decreases. It's for the pain gate theory. But pain gate theory can't tell us a lot of things. For example, what kind of a pain feel a patient with absence of his feet or his hand due to trauma, injury, or maybe operation activity? Why paper cuts hurt so much? For example, or maybe such an interesting thing when you are running, maybe at the beach, and step on the nail. Does it hurt? Yes, it is. It hurts. And you stop, you catch your foot, try to fix, to glide it. But just imagine this is the same situation. You are running at the beach, step on the nail, turn around and see the lion. He is going for you. And you will all pay no attention to the nail, will keep running, maybe more faster than before. The same nail, the same pain, but the different situation. We don't know. So the pain gate theory shows that nociceptors activated creates impulse going up by a slow nerves path, and nociceptors activated keep the impulses moving to the brain via fast nerve path. And pain gate theory says that there is a kind of situation due to crossroads. When you have crossroads without traffic lights, you have a lot of cars going over the main street, and next cars have to wait for them. It looks like a pain gate theory, and why we mitigate the pain affecting mechanoceptors. Pain gate theory in life, we already spoke about it. But why we speak about pain so much? Because pain change our way of movement absolutely in unpredictable way. Even it's not under our conscious function. So we'll get a bad habit, a postural compensation, even don't thinking about it, without your willing. When we speak about the situation with a nail and lion, we speak about different outputs and biopsychosocial system. It depends, it really depends on our condition, our mood, our health, even the way of year. To reduce pain, we need to put us in a safer position. That's why when you have a child crying, mother gives him, he feel himself in self position and he keeps quiet. The same idea we can apply for different parts of our body. Kinesiotaping, it creates the feeling of safety and the pain decrease. Biopsychosocial model of realizing our pain depends on different factors. Psychological, social factors, biological. We still don't know exactly all the ideas how we create the pain, so we don't know exactly how to decrease the pain. Posture and its relation with a different pain condition. Here is an MRI of low back part of our spine. You see the problem here, yeah? And I ask you, what do you think about taping in this case? And about ability of kinesiotape to decrease the pain in this case? Is it worth doing or not? What do you think? Huh? It helps. Yeah, why? We know exactly that origin of pain is neurological. Agreed. Because anyway, when we apply something to reduce pain, it will be better than way to do nothing. Really, no tape in the world will affect the origin of the pain, etiology of this pain. It's just neurological. But doing something will decrease the pain anyway. So, optimal congruent joint position help to keep our joints in proper centration, and thus we'll have no problems with pain feelings in different parts of our body. When we have bad postural, for example, today will speak mostly about core dysfunctions. It's due to lower cross syndrome. So we have some muscles weak, some muscles tight, they fixed in this condition, and you may spend a lot of times, weeks, months to treat low back pain syndrome, and if you are not managing with etiology of this pain, you will get nothing. But maybe it's worth doing because you have patient, he will come and come and come, pay and pay. Maybe it's commercial idea. We have a certain number of very interesting investigations that show that, for example, low back pain is related with different fasciitis. So, decrease of fascia gliding in this area can provide the pain feeling. And we have very interesting one more investigation, and it's from North America, am I right? And they tell in this investigation that we have only 10% of neurological origin of pain related with low back place. 90% is not neurological etiology. It's muscles, posture disorders, and so on. Here is, look in the right, on your left, no low back pain. Make a notice that we see a good amount of gliding among superficial and deep fascia. Here, with low back pain, we see the signs of fasciitis. We see some kind of connective tissue fibrosis between superficial and deep fascia, and its gliding ability became lower. The same idea, maybe improving glide stability between fascia, we can decrease pain in low back syndrome. And it really is. Interlayer gliding depends upon lack of the hyaluronic acid between superficial and deep fascia. And we can increase the amount of hyaluronic acid applying different tools, for example, blading, mohawk, different ways of improving gliding, flossing, different corrective exercises, manual techniques. Here is the relationship between superficial and deep parts of our skin. And you see where we need more hyaluronic acid. So maybe we can manage with fascia instead a lot of inflammatory drugs that we give to our patient in order to decrease his pain. Gliding, improving. Blading instruments, manual techniques, they are very helpful in idea to fight with fasciitis. When you apply instruments, you will feel a little bit crepitation inside skin. It's a result of working with superficial and deep fascia. Mohawk instrument for more precision, working over the trigger points. We can go deeper, can go exactly in the chosen points. We can work with the silicone coverage to improve gliding ability. We can work with the comp attachment to decrease pain feeling. We have one more safe and effective instrument to fight with fasciitis anywhere you can find it. It's how to manage with it. Also, we find it very useful if you have such ability to perform ultrasonography detection while performing your manipulation, because you must to see the deepness of your influence. Also, you must check it before, check it after, and to have the feedback of your manual technique treatment. In our practice, we do it, but not in portable, in professional, in Logic 9, and we really see the difference. We keep our data for investigations, and also it's very obvious for patient to see the changes between and after. Kinesiotaping and its influence for thoracolumbar fascia. Also, we have a lot of investigations, and now we have no doubt about the helpfulness of kinesiotaping as a locking agent after our manipulations over the trigger point. Thoracolumbar fascia, applying kinesiotape, it's one more investigation, and we see the change of movement and change of movement around between superficial and deep fascia. Who are interested in a modern investigation, you can easily find it on rocktape.com site. They are free. One more idea how to detect one's ability and how to manage with one's pain feeling is two-point dot discrimination tests. So, when a person creates a chronic, low-intensity chronic pain, his brain, it's a kind of forgetfulness. He forgets this area and takes it under his supervision. And to restore the idea of our proper brain control over the chosen area, we need to improve our body representation at our cortex system. We can detect it and to diagnose it via testing tactile acuity. For example, in the case of low back pain, we perform 2-dot tests and see increasing of one's ability to be responsible for detecting 2 points as 2 points. And also, we can teach our brain to speak with it, improving one's ability to represent his own body parts and his cortex, studying, improving his way to detect 2 points as a 2 points with a decreasing of the distance, and thus will have a pain mitigation effects. It's more neurological, it's about body map. Our brain is a kind of our healthman, and it's rule our body with the help of different devices and coming information from different parts of our body. Our skin have a lot of recipes affecting which our brain can coordinate and change our body representation at our brain. We need body mapping, so-called body mapping, to decrease pain and to improve one's ability to work properly, because in the end of rehab program, we have corrective exercises, and to perform them correctly, we need proper body representation of one's body at its brain. So we need to connect the dot, and we improve one's ability to control and to decrease pain while affecting recipes placed on the skin. It's usually very hard to explain a person how to perform corrective exercises if he is not responsible for his body, and if he has deficiency of his body representation at his brain. So first we start with examining tests to see subconscious dysfunction. First, you have to make the judgment about one's ability to perform movement correctly. Then you must attach one's to help or ask one to fix his eyes on his conscious dysfunction. So your patient must realize that he does this movement wrong. Then you put it into conscious function. So you ask him to keep his eyes on performing correct way of corrective exercise all the way. And only after a certain number of time, it will go into subconscious function, when your patient will not pay conscious attention to his way of moving, but his moving will be right. So he will get a right way of proper movement as a result of whole rehab program. By the way, most people in this room, we are subconsciously dysfuncted, but we are not realize it, because we know ourselves, and we thought that it is right. But we can do a number of simple tests to see it is not. I will show you one test. It may be useful for you. Lay on your stomach here. It's about timing. Do you know what is timing? Timing is our ability to contract the chosen muscle according to our will. Yes? Get me? So I need one assistant. Better it will be a girl, maybe a boy. I have it. Okay. So, I stand here, please. Idea is very simple. I ask her to flex this muscle, and this muscle simultaneously. Do it. Good for you. Relax. Once again, this muscle, and this muscle. Do it. Okay. So you'll have a signal. I will clap my hands, and only for this signal, you must flex simultaneously. Let it be this, and this muscle. You must keep your hands like this, here and here. Okay, are you ready? Just only when I'm clap my hands. Okay, what was contracted first? Here, and ask her to make it simultaneously. She tries, but she's not able because she have a weak gluteus. We'll see it later. Okay, thanks. So it's about timing, and it's about our way of stand up, of body representation.
Can I go to my place?
Thanks a lot. Well, so that's why we need her and other patient to get the subconscious dysfunction into conscious. Here is the idea. Well, it's time to decision. So we are managing with mobility and with stability in different ways, because we have parts in our bodies that must be stable, we have the parts of our organism that must be mobile, and all of them under proper motor control. Only this way we'll have more 5 years for our longevity. We have a lot of diagnostic tools to diagnose different problems in heart disease system, in cardiovascular system. But we still have a very poor number of diagnostic tools to detect our postural disorders. So we still have a lot of different functional moving technique. And we'll speak some about simple and use tests how to determine our core dysfunction. We'll start from the breathing test. Breathing test is about our ability for proper way of breathing. Proper way of breathing is abdominal breathing. Only in this way we'll have proper way of working diaphragm. So, how to test it? Sit face to the attendee. Sit here, okay? Place your one hand here, and make a deep inhale. Do it. Deep, deep. You may do the same thing. One hand here, one here, and inhale. And you will see which part of your body is working now. Mostly it's chest. Yeah? Which part of your body is moving now?
This one.
Oh.
I have practiced it.
She's a good one. Yes. So, we mostly breathe with our stomach, but our way of life is forced to change our ability for breathing for the breast. Relax. Optimal breathing pattern is a thing to be trained. You know, yoga practice pay a lot attention for the breathing pattern because they know that our diaphragm and abnormal breathing patterns. Oh, that's me. That's not me. Will affect our fascia, deep fascia, pelvis floor, cardiovascular fascia, lung fascia, and will decrease ability of the organs to be safe and in good functioning. One more idea for lazy screening setup. From the supine position, you perform the same test. Perform supine position. Like this. Perfect supine position. And once again, inhale and exhale. She's not lying. You see, she's breathing with your stomach. It's first time in my practice I see the real man who's breathing with his stomach. Good for you. Okay, enough, I think. Ivona, stop breathing. And sit, please. Well, so breathing screen dysfunction patterns, rib flare, and apical patterns because of bad breast excursion. If you are not involved in yoga practice, you have to create something to improve one's ability to improve breathing pattern. You may use different tools. For example, professional tools, you know that idea? L-adapter from Dr. Wolf. Nobody familiar with it? It's a kind of physical therapy machine. Stand it. They have detect dot here, and when she breathes in proper condition, we have movement, a little bit movement according to her low back spine, and she see the dot moving, and she can maintain with her ability to move this part of her body. But it's bad posture. No, 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 no. One more idea how we can manage with breathing pattern. We must do something that will decrease her ability for breathing, for lung breathing. We can use, for example, floss. Unpalpate her ribs arc, make a cross of floss here. Put your hands like this. Okay, thanks. You just make a circle here. One time is enough. And you may ask her now to perform breathing. So you shorten her lung excursion and force her to improve her stomach ability for breathing. Okay, so we need to help one's ability to change his breathing pattern with different tools, because you see our body representation are not perfect. Well, one more dysfunction we can speak, and we usually see when we perform different tests, for example, plank tests. We see one's inability to keep his posture in proper position. Also, we keep our eyes in one more dysfunctional patterns, like low back position, curved position, and so on. More complicated tests, for example, Professor Lumayoki tests, it's also for, come to me, it's also for examining our ability to keep our core in proper postural. So, first, back, weight above, flexion on hip. So we ask her to flex her hip and to move your pelvis without adding your lower extremity. One more. Our idea is to see if he's able to move only with your pelvis. You see? Straight body on with pelvis. And you keep your eyes not in him, but in her. Any idea? Enough. She can't manage with her pelvis. She put all the tension into quadratus lumborum.
So you want me to bend my knees?
A little bit, and keep them bended, okay? And performance again, we'll get the same results because gluteus are weak. He can't make the pelvis extension. Okay, next test. Rocking. Dorsal lift, so stand straight and perform this movement, and we must keep our eyes at her postural compensation. Okay, do it. It's a movement from nightclub dancing. We usually like to additional music on it. Okay, do it. The same. She tried to work it here, tried to work here, but not in the chosen area. Well, once again, one leg stands, face the people, and one leg stands. One leg stands, and we keep our eyes on trochanter and see the distance of moving. It must not be more than 8 centimeters in each side. Okay, slowly lift your leg. Keep here a distance of 20 centimeters. Okay, and now, once again. Once again. You see, she's lifted more on the left side. Yeah? Okay. So sit here, sit here. Now, you must unflex one leg, and we see, is it possible for her without additional pathological compensation program? Okay. Once again. Right one. Right one. Yeah? She's flexing her trunk. Okay. One more is rocking. (130°). Keep your back straight and try to rock, keeping your back straight. No, it's very interesting, but we like it. But you see, she's unable to keep her back straight. We have a hyperlordosis here, and it's obvious. Okay, thanks. And one more test. Lay on your stomach. Keep your forehead here. Okay. And flex one neck. Okay, another one. A little bit compensation we have on her right or left hand also, where we have more distance when we perform a one leg stance test. If I can complicate it. So if I add force, flex it, it will be more obvious. Once again, flex it. No, relax. Flex it. More power. Okay, thanks. Turn around. And here we see why we have deficiency on her left side. You see it? Yeah? Muscle deficiency. So he worked mostly on her right side. Yeah. All this data give us a possibility to create a special way of recovering program exactly for her. After we detect her deficiency, we get a judgment, what muscles are weak, what muscles are tight. Then we try to normalize muscle tone in all chosen area. Then we work with the trigger points. Then we lock in our changes with the help of kinesiotape, and only after it, we can allow her to go to corrective exercises. Well, but it might be not more than enough. It might be not enough, yeah. Because it's only my opinion. You see her movement, you see your movement. It's only yours opinion, and we can't operate with your data because it's your opinion. We need something to make it objective. Posture. Posture is something we can't touch. It's dynamic, it's not stable. It will change during our life due to different conditions. And when we're speaking about investigations, we keep in our minds 3D plane also, and we need something to determine it exactly in centimeters, in different angles, and so on. So, we speak about different apps, we speak about results of these apps. Also, we have a more investigated devices to detect postural disorders. We have Centaur, we have L-adapters to see exactly, to measure her deficiency. Also, it's for the photometric by Deers, maybe you're familiar with it. Here is a sample of data sheet we get after our posture measurement. We get whole data about each spine position, each joint position, angles, while static position, while dynamic position. It helps us to establish exactly individual correct exercises and then see our dynamic in future. Here is the sample data from Centaur. We see the postural deficiency, one's disability to keep his core posture in right side. And also, we need something to measure one's ability about muscle tone, because it's also my opinion. Make different way of diagnostic, but it's only my opinion. I need something to touch. Well, about core. Our core is a part of performance core chain, and it also related with different muscles that working in synergy. And if we are not put them into proper position, we'll not have a possibility to manage, for example, with low back pain, and also we can't allow her to improve her professional ability for moving without her ability to keep postural in proper position. Here is the way of relationship, proper and not proper breathing with the diaphragm and pelvic floor. You see that deep fascia is related with lungs pleura, cardiac pleura, and also iliopsoas muscle. Do you know that animal? Who sees the Discovery Channel? No one? It's sea squirt. It's an animal, it's sea animal, and it's very interesting that she is swimming under the water somewhere, and she needs something stable to fix on it. And when she gets that place, she fixes on it. Okay. Make a movie about her. She's more handsome than I.
Yes, I have. The camera wants you both.
Ah. Okay, so about this animal. So she needs to fix somewhere for whole life. When she's swimming under the water and sees a place to fix on it, she has a brain. After it fixed, she degassed her brain because she needed anymore. She or he, I don't know. She need not move. So she need not brain. And it's very interesting. It's about role of our brain in our ability to coordinate our movement and to have it in proper way. Taping work as a silent reminder, affecting different proprioception in different part of our body and help us not to be encouraged like an encouraged trainer. Keep straight, keep straight, keep straight. It's not a good idea. I'm better place a silent reminder on her back and ask her to perform different way of corrective exercises without my words. Well, here is the framework. How to create our idea for a hub technique. First, we do not forget that skin is full of recipes and affecting them, we can conversate with our brain. Also, screen movement, we don't screen muscles, but if you need, we have a lot of certain reliable tests for muscle power. Also, we have a lot of devices to measure muscle power and muscle condition. We use fascia as a map, and we also train the brain via right way of performing corrective exercises. We can't change her bones and her joints, for example, but we can manage with her soft tissue. So we can put her in another model and she will feel herself much more better. Rock tape movement pyramid starts from screening, different way of screening. Then we make assessment. Then we make certain number of manipulation with soft tissue tools like balls, like foam rollers, like TheraBands, rigid bands, and so on. If we have a trigger points and muscle fasciitis, we can work with the blade technique, Mohawk technique. Also, we use rock tape for locking and corrective exercise on the top. What for I'm told it? We have no protocol-based technique. We have no ready solutions for any injury case you can meet in your professional daily life. We only have a concept that are suitable for any case, for any trauma, and if you get it well, you will be able to perform, to construct individual and very effective rehab technique using all the ideas in movement concept. Corrective exercise start from decreasing tension. We start from non-weight bearing, quadruped, kneeling, standing, and so about resistance. Without resistance, passive, active, and with resistance. Different movability tools were used in. We have additional courses for each of them, but I think you're familiar with the technique. If you have in your heads idea how to use it, you will be successful. Way of intervention, so how to manage with one's ability to change their way of breathing. Also, different way of corrective exercises, but once again, you are able to perform them only after you are get a good results in her postural control ability. Well, come to me. Don't come to me. Stay here. Lay back. Let us create something like this. I have here a modern rehab device, and I will show you how to manage with it. Come closer. Lay back. Okay, so now from this position, we'll ask her, place your hand over her stomach and ask her to inhale with her stomach, do it, and exhale. So your hand affects her mechanoceptors and help her to detect what muscle must be contracted under providing this movement. Once again. And you must keep the other hand under her low back area to be sure that she moves her pelvis back when exhaling. Once again, it's very short distant movement. She extends her pelvis not more than for a couple of centimeters, but this is very useful to change her way of movement and to help her to improve her ability to keep pelvis floor in proper position. Okay, stand it up. Also, if we are managing with the lower cross syndrome, we have weak muscles here and weak muscles here. And we need to affect them. We may use rolling balls, and a wall, and ask her to roll fast in short period, not more than 30-40 seconds, to affect mechanoceptors to increase muscle tone in her rectus abdomini. So we are speaking about upregulation, Pacini recipes. I have no wall, I have no ball, but I have Ivona. Once again, foam roller improve gliding, improve one's amount of hyaluronic acid that are responsible for proper gliding between superficial and deep fascia. Also, it's a part of rehabilitation program. And as, again, now we are working with the gluteus. The same idea. Corrective exercises, they are divided into isolation exercises and integration exercises. Isolation exercises. Stand here. I was asked to stand under the lamp slide. On your... No, turn to the back. Oh, turn here. It's more evident. Okay. And now, yeah. One leg, one hand. Okay. Our idea to keep our eyes, yes, she need. She won't, but she's not able. We'll see some tips later how to move it. We can place here a rubber circle to improve her ability to fix her eye on gluteus extension. Here it is. We can take something, once again. Oh, it's garbage here. It's not clean. Who are responsible for floor? Nobody knows. You may take a ball. Let it be a ball. Or a foam roller. Place it here and perform it once again. The same movement. Here is a bioback answer. Once again, do it. No. Start position. Okay. So you must keep your posture like this. Feel it and keep it here. Once again, slowly. It's compensation. He can't flex her hip without gluteus. Okay, stand it. You nice girl, don't listen me. Integration. We use more complicated exercises, for example, when she to keep balance and to fix her core muscles contracted with the back tension or kind of Brugger. You know Brugger? Integrative exercises with the help of rubber band. One more ways of integrative exercises, but in regression way, when she is lying on her floor and she needn't to keep balance standing. Here is a way how to restore bioback control with the help of ball I told you about. But it's more complicated exercises because she is not fixed on 4 point. Let us do it. Here. Okay, the same starting pose, but now you are not. No. The same thing. Stand releve. Okay. Good position. Come to me here. Oh. Good. Yes. Don't touch the floor by your knees. Okay. Keep it. Ow. 30 seconds, 40 seconds. The time must rise up in each corrective exercise session. Okay? No. More flexion. And now, this way. Up and down. Okay. And all the way, you must keep your eyes on her ability to fix the core stable. Okay. Go down. Now, I want you to move. On your legs and hands. Like a beer. You know beer? No. Stop it. Start pose, start position. Good. Here is the way of stable core. Make it stable core. Keep balance here. And now, right hand, right leg. And move forward. Come to me. It's very complicated. It's really. I'm showing you how you can improve one's ability for correct exercises. Also, if you like your patient, stand it up. Keep the pose starting. Keep it. Good for you. And give me a hand. Keep the pose. Give me a hand. Yeah, just touch me. Next one. Okay. Slowly. What is it? Slowly. Give it. She is moving. Okay, stand it up. How do you feel it? Hate me. Okay. Well, so here is the way of integration, how to move with it. Then we use kinesiotape after it or before it to improve force couple, lung tension in chosen muscles to improve the ability for contraction. Here is the way of taping postural disorders related with the core dysfunction. Why we take postural? Because we need to keep our mouth closed and to help silent reminders work for us. Also, kinesthetic guidance help her to improve her ability for proprioception many times faster than my tongue or than my hands. Taping for proprioceptions improve our feedback and help us to restore proper proprioceptions. And also, we know that the posture is function, and function is performance. To improve one's performance, we must start from the posture, because best posture can't allow you to improve your physical capacities in any way. Here is taping proprioceptions, and person with a taping with a better feedback shows better results in keeping proper posture. Also, we used a lot of rehab therapy in our practice, but it's not the idea. So after we manage with the pain syndrome, we allow a person to get into special corrective exercises rehab program, because the main idea is to restore her ability to perform function in the right way and to prevent her for possible injuries in future. I think that's all for me. Okay.